and that will not add to our deficit over the next decade. It brings down our deficit by more than $1 trillion over the next 2 decades, which will go a long way towards controlling these costs. That costs are going down.
President Obama promised you that the Affordable Care Act would cut health care costs. We now know that's not true. The most recent CBO estimate is that Obamacare will cost more than $2 trillion over the next decade. And a new report by Senator Tom Coburn shows it will be even more than that, way more, maybe even 31,000% more. How does he know? Senator Coburn joins us. Nice to see you, sir.
Good to see you.
31,000% more. I mean, that's even hard to understand. That's so huge.
Well, that's the history of how good we are at estimating costs. I mean, you just take what the CBO said this year versus what they said when the bill was passed. We're now twice as much. That's what they said.
So you go back to what, 1966?
2000? No. I'm talking just all about the Affordable Care Act, $1 trillion.
That's 31,000%.
No, well, that's a doubling of what they thought it was going to cost over the life of the program. So the point is we're not any good at estimating it, costs, and that's the study that we just put out that's up on our website. It's showing here's what we said when we started the program, here's what it costs today. And in the case of Medicaid, 31,000% from the time it started in 1966 to 2012. In other words, they missed it by 310 times.
Well, I guess, you know, in looking at your study, I would feel a little bit better if sometimes we estimated it wrong in our favor. You know, where we actually saved money or we got some extra money. But when I look at the numbers here, they are incredible how poor the estimates were. And they were always, you know, hugely more costly.
Well, but to be fair, some of the increase, Greta, is because politicians, to enhance their own careers, have expanded the programs with either richer benefits or a wider purview of people. I mean, just think, that's Medicaid, 31,000%, and we're going to essentially almost double the number of people in Medicaid if the Affordable Care Act was totally implemented. And knowing that the Medicaid is a substandard system that doesn't give as good a care and denies access when it promises access. So that's the kind of health care we're going into, and then the cost for it is going to be far higher than what we say it's going to cost.
Is there anything from your report, from your study of the costs, that should make anyone feel better?
Yes.
What?
If you look at the Medicare Part D, if you look at what it was estimated to cost, it came in far below the cost. And
so there is one.
Yeah, there's a couple of reasons for that. Number one, it was based on the way we allocate scarce resources everywhere else in our economy when the government isn't involved, which is markets and access. And so had you had a health care plan that used market forces and consumer choice and, you know, cost you more if you want more, cost you less if you want less, what you would see is costs would markedly go down.
Well, that was a little bit about the early thoughts about Obamacare, the first discussion.
Well, that's what they said.
There would be a market exchange.
Yeah, but that's what they said. No, well, but there's no real free market in Obamacare. Here's what you must buy.
The menu.
Yeah. Here you have 3 choices. If you're in Washington and work for the federal government and are in the exchange, you have no choice. You get one plan. And it's a captive audience, so that's the only place you can buy it. And we'll tell you what you can. So there's no consumer choice. And there's very little transparency, and that's the first year only. We don't have any idea what's going to happen when they see the experience ratios, the loss ratios.
Give me your estimate a year from now if we have a conversation about this. What would it be? What would we be saying about Obamacare?
I think number one, everybody agrees the system we had wasn't working well. Number two, this is much worse than even the harshest critics have said it's going to be in terms of disrupting health care, denying people access. I mean, a report out today by the U.S. National Association of Manufacturers. 60 million people employed in manufacturing are going to lose their insurance in the next year. Now think about that. 60 million who are happy with what they have today are going to lose their insurance. They're going to go onto an exchange and buy what they have 3 choices, and they're going to have to buy one of those 3 choices. Not what they want, not what they need, and not necessarily with their doctor. So you don't get to keep what you had. You don't necessarily get to keep the doctor you have. And oh, by the way, the deductibles and cost is going up.
Senator, thank you. Always nice to see you, sir.
Good to see you.
Thank you. Coming up, Toronto.